Cold laser therapy. Cold laser therapy is an alternative therapy. Alternative therapies have evolved over the last few generations and have really become inclusive in the animal world. There is just more and more research being done on, and they're improving integrative medicine for the use in animals, and many people are excited to try holistic therapies. One of the holistic therapies that is really being used a lot in today's veterinary world is cold laser therapy. It is used not only as a standalone treatment, but also with other medical aids, and it is relatively easy to use. It is also seemingly easy to teach a veterinary technician how to use cold therapy lasers in just one setting, as the machine itself will walk you through the whole process from choosing the correct size heads all the way to how to hold the head actually on the animal, whether it is in a using in a crisscross method, or if it is where you can just leave it in one particular space. Cold lasers are easy to store, and it is very helpful to have a laminated guide attached to the laser machine that includes any warnings, such as that there are dangers to exposure of eyes. So the history of laser light is a little controversial. There is a couple of different things you can find when looking on the internet. Now, our book does state that in 1957, laser light therapy was conceived and named after Gordon Gould, and he is credited as the inventor. But when researched, I did find that that's not always who they claim was the inventor. In 1964, Andre Mester began experimenting with cold laser therapy. The thought process at first was that cold laser would lead to cancer, as you know, it's light. They were thinking kind of like the UV lights from the sun. It was actually found that no, cold lasers can help heal. Cold lasers have been used in the United States since the 1970s relatively consistently, but in the last just 10, 20 years have really made a big impact and have switched over to just regular veterinary clinics having access. What is it and why do we use it? So cold laser beam is a coherent light that stays tightly focused with a narrow beam with waves that are all the same phase and usually the same color. A cold laser is a low-level laser that does not burn when it touches the skin, and it is useful in healing tissue. It is primarily used for wound healing and pain. Specific uses. So it can be used for anti-inflammatory, arthritis, strains or sprains, surgical sites, traumatic injuries, and pets with limited treatment options. Cold laser works by stimulating the body's natural production of ATP. This form of energy helps the body heal more quickly. Pets with limited medical treatment options, like cats who cannot take certain medications, or animals in organ failure, and even pets who cannot receive medications due to the difficulty of administering it, can be great candidates for cold laser therapy. So the benefits really outweigh the negatives. So for one, non-invasive and it's pain-free. The cold laser is beneficial in providing animals with non-invasive, pain-free treatment for many conditions, including the wound healing process. It relieves and lowers the pain. It uses deep penetrating light to promote a chain of chemical reactions known as photobiostimulation. It reduces inflammation and helps with healing. Vasodilation assists in inflammation by increasing blood flow to the damaged cells and tissues. This enables the delivery of the immune cells necessary for defense and repair. Lymphatic drainage is helpful in draining the fluid from the swollen areas. So the thought process is less fluid, less pain. And then relaxation occurs simply for the fact that they associate the feeling of laser therapy with less pain, and then they're more comfortable afterwards. So side effects are, there really aren't a huge amount of side effects. The most, notable are that the higher powered lasers run a risk of inducing thermal burns when used improperly. And then lasers can damage the eyes if they are, shown directly into the eyes or even reflecting off of surfaces. And then immunosuppressant patients can really have issues because the therapy may contradict their immunosuppressive drugs. So when using a laser, the patient should be on a non-reflective surface. All reflective surfaces nearby should be covered to prevent any kind of bounce back. And this protects not only the patient, but also the operator of the machine. So we don't really want to use cold laser therapy in patients who have certain problems such as lymphoma or those on immunosuppressant drugs, like stated previously. Patients under a year old also aren't the most, most thought of candidate because they can have some premature closings. And then operators should be certain that the laser has a clear indicator of where the beam is pointing. So all operators of cold laser therapy should be prepared to wear goggles for the whole procedure. All patients should also be wearing goggles, and the laser should never be pointed in an area that is not the treatment area. So, if the wound is on the leg, we don't want to be shining the laser on the chest, something like that. We want to focus the laser on the area that needs the healing. And it should be turned off when not in use. Again, more contradictions. Eye exposure is the, one of the number one contradictions, as well as, pregnancy, hemorrhage, other things that we need to take as precautions. We want to make sure that the animal is healthy enough for cold laser, and that is determined by your veterinarian. So in conclusion, laser therapy appears to have some subjective benefits. Potential areas where laser therapy can be incorporated is wound healing, pain management, and rehabilitation of various conditions. So the use of cold laser treatments has been around since the early 60s and has evolved over the years. It only takes a few minutes and is deemed safe with only a few contradictions. Many owners have reported improvement in the gait of the pet and increased activity level after sessions. Owners seem compliant with the therapy when it is included in a price package with surgery, or if it is set as a discount with rehabilitation therapy. Also, it's small in size and portable and can be taken pretty much anywhere with you. And it's not only just for companion animals, so not just for dogs and cats. It can be used on livestock, horses in particular, as well as exotics and zoo animals.